Well, nearly a dozen new state laws take into full effect here in Georgia tonight, and that includes the CATCH Act, which stands for Consumer Access to Contracted Health Care Act.
Yeah, it adds protections for those who have health insurance by guaranteeing that they can get certain types of care. 11 Alive's Don White spoke to a doctor about how he hopes this can cut the red tape for patients.
The CATCH Act sets standards for health insurance plans and guarantees everyone who has health insurance has access to both primary and secondary care, regardless of where they live. It's a frustration Dr. Cecil Bennett with Noonan Family Medicine Associates knows all too well.
Many times I refer patients to specialists and they're unable to see them because either there are not enough of those specialists in a network or my patient has to drive too far to access those services.
The CATCH Act changes that by doing several things, including prohibiting an insurer from denying pre-authorization because a referral was made by a non-participating provider, and making sure people have access to various types of care within a reasonable distance from where they live.
As many as 1/3 of my patients need additional mental health support.
One of the things the legislation guarantees is access to mental health care and substance abuse treatment programs.
Many times I would like them to see a therapist, and I hear over and over again that my plan does not allow me to see a therapist, or the therapist they sent me to, it's an hour drive to get to them.
Also included in the law is a larger choice of pharmacies.
They may decide that there are only certain pharmacies that they will allow you to access based on their plan. This will allow broader access for patients to have a choice between which pharmacies they want to go to.
Finally, the CATCH Act adds protections for patients who use telemedicine.
A plan may say, yes, you have access to telehealth, but they limit the platforms that you can use, meaning you can only use Zoom or you can only use Team. But if all you have is FaceTime, you no longer have access to your healthcare provider.
Insurance companies have to start reporting their compliance to the state health commissioner annually beginning January 2025. Outside the state capitol, Don White, 11 Alive News.
Now, the CATCH Act was just one of several new laws now on the books here in the state. Another one of note, Georgia's flat income tax rate is going down. It came into 2024 at 5.75%, but the law signed by Governor Kemp will bring it down to 4.99% by the start of 2029. And another new law stops companies from putting what's termed unnecessary barriers in place to cancel online subscriptions. I like that one. All right, finally, starting today, 911 operators in Georgia are now required to complete annual training on how to give CPR instructions over the phone. You can catch up on all these new laws in effect right now online at 11alive.com. The article is under our featured section on the homepage.